So a lot of patients don't have access to a recliner at home following a rotator cuff repair surgery. So in this video, what I'm going to do is show you how to get comfortable on the couch, keeping your sling on. And then I'm going to show you a couple exercises you can do from the couch position to work on active or active assisted flexion during your physical therapy home sessions. So first thing is, how do I get comfortable? Typically, if you have a long enough couch or you have a short enough body, you can lay on the couch. I'm pretending it's my left shoulder that has had surgery. I've got the sling on, imagine. I've got the abduction pillow right underneath me. So what's nice about the couch, better actually than the recliner, is I can back into the couch, and this will help to allow my arm to just rest comfortably so that I don't have to worry about dropping down behind me. The biggest complaint I have from patients who have had a rotator cuff repair surgery is that when they lay in bed, they can't tolerate letting the shoulder drop down onto the bed surface. So typically, we're going to be in this kind of quarter turn position, backed into the back of the couch with the surgical side on top. The sling is on. Most of your surgeons will have post-surgical protocols requiring you to wear the sling at least 4 weeks, sometimes 6 weeks after surgery. So just abide by that protocol. Follow your orthopedic surgeon's advice. Now, if I'm doing exercise, if I've been cleared by my physical therapist, I've been prescribed home exercises, one of the exercises you might have seen is called a finger ladder or fingers up the wall. One of the ways that I prefer to do it, if I'm out of the sling, is I would go to my stomach. Now, some of you have spinal stenosis and other lumbar pain conditions. If you can't lay on your stomach, I'll give you other exercises that could be done in replacement of this. But if you are able to get on your stomach, we call that the prone position. One of my favorite ways to work on flexion is simply to allow gravity to go ahead and pull the hand down into this position. Now, a couple reasons why this is really a beneficial position for anybody who's had rotator cuff repair surgery. Part of it is the cushion here is actually gently pressing the humeral head away from my body, which is creating a little bit of space inside the glenohumeral joint. Here comes my buddy Tucker. He's going to help us with our exercises. So I know a lot of you have dogs at home. Just be aware that your dog can either be in the way or, at worst, can actually cause damage or harm to the rotator cuff repair. So just be careful when you're doing that. Tucker, down, down. Good boy. All right, so what you're going to be doing, you're going to lie belly down in this position. You're going to allow the arm to just rest. I'm passively already at 90 degrees of flexion. But if you want to get a little more flexion, you can do the finger walk on the floor. So my hand's down, my fingers are carrying the hand forward. I go as far as I feel comfortable, and then I allow it to just maintain that position for a little while before I bring it back. Another position from the couch, hey buddy, once you're allowed to start doing active range of motion, is I can be in this side lying position and I can start to move into external rotation. Now, this is an active exercise. This is usually not allowed before the 4 to 6 week rest period. So you have to determine with your surgeon when you're allowed to start doing active exercise. But one of my favorites right here, my target is to bring my hand back to the cushions behind me, come back down. I'm controlling the ascent. I'm controlling the descent. I can also do a horizontal abduction coming up into the overhead position. What's nice about this is I've got my armrest up here as my target for full motion. The last position is going to be an internal rotation direction where I'm working on getting my hand, my knuckles to the middle of my low back. So this would be a position that I could spend some time in. I can do it sideways here as well, so that my elbow is supported by the back of the couch. So guys, the main thing here is don't do any of these exercises until you clear it with either your surgeon or your physical therapist, because they will have your post-surgical protocol. But I just want you to understand that there are a lot of things that you can do around the house. You can find comfort in positioning on the couch with the support of the backrest. And if you have any other questions about other kinds of exercises or landmarks or things that you should be doing at certain stages in your recovery, feel free to let me know. I will catch you guys on the next video.